All right, so the next bit of information that we're going to touch on is the Glasgow Coma Scale. And we're going to use the Glasgow Coma Scale to measure a patient's alertness or their level of consciousness. So we would mainly probably use this when we notice that our patient's alertness or consciousness level is going down. And what this is an objective measurement of their consciousness. Now remember, objective because we are assessing. Subjective is when the subject tells us my nose hurts or my leg hurts. Objective is when we go and look for ourselves. So when doing the test on a patient, if they have an increased score, so the higher the score, the more alert that they are. And if their score is lower, then that is a decrease in alertness. And when looking at the Glasgow Coma Scale, the maximum score that they can get is a 15. So if they're a 15, the patient is alert and, likely no worries. Now, if they have closer to like a 4 or a 5, then obviously they're going to have a decrease in their level of alertness. Now, there are 3 sections within the Glasgow Coma Scale, and it's going to be eyes open, verbal, and motor response. So with their eyes, do they respond to speech, to pain, any response at all? And then as far as verbal, do they have a response? Are they oriented? Are they confused? Do they use inappropriate words like, how are you today? Banana. Okay, that doesn't make sense. To include incomprehensible sounds. Are they just making sounds, that maybe don't make sense? As far as motor, and their response, do they obey commands? So, all right, Miss Susie, put your finger on your nose, your right finger on your nose. Can they do that? Do they respond and move and do the commands that you're asking them to do? Do they have flexion withdrawal? Do they have an abnormal flexion? Do they have an abnormal extension? And then flaccid. So those are going to be the 3 categories of the scale that we're going to assess. And if you think about it, that's going to tell us the neurological status of our patient. So again, there's the 3 categories within the scale, and it's going to be eyes open and verbal motor response. So again, maximum score is 15. If they have a score that's closer to 15, they're going to be more alert. A score that's closer to like 4 or 5, they're going to have a decrease in their alertness. And again, we use this scale as an objective measurement of our patient's consciousness levels. Come back for more.